The report details the experiences of 30 Guyanese women with disabilities who dealt with gender-based violence, GBV, in their intimate relationships and in their respective homes during the COVID-19 pandemic. A transnational team of 9 researchers, including women with and without disabilities, in collaboration with the Guyana Council of Organization for Persons with Disabilities and Red Thread, conducted the research between 2021 and 2023. Lead researcher Kendra Ann Smith, in presenting the team's findings, says it was an alarming reality based on work done in the field of gender-based violence that the stories of women with disabilities are often not given an audience, adding that during the COVID-19 pandemic, there was an increase in the number of reports about GBV across the globe.
One of the other things that research tells us is that women with disabilities experience gender-based violence at higher rates than non-disabled women. And so one of the things that our community partners and we as researchers began to wonder about is what is happening for women with disability.
According to Pitt, the research consisted of 3 main objectives, which provided guidance in gathering and analyzing materials.
We wanted to explore the challenges that were particular to COVID-19 social distancing and lockdown measures for women with disabilities who were experiencing gender-based violence. We wanted to understand how women who were experiencing gender-based violence in these conditions were coping.
Women between the ages of 20 to 54 from regions 2, 3, 4, 5, 6, and 10 were interviewed. The research found that there were a series of experiences of marginalization and exclusion which severely impacted response to GBV, particularly during COVID-19.
Talked about the experiences of stigma. Women talked about the experiences of being excluded from education, being excluded from employment, and all of these conditions made it even more difficult for some women to actually respond to gender-based violence. And what it actually does is it tells us a larger story, I think, about the ways in which women with disabilities and also people with disabilities more generally experience what we would call structural violence.
The results showed a reflection of a range of structural inequities that were foundational to how they experienced and navigated GBV. The intersecting inequities produced by ableism, sexism, and patriarchy, inequitable economic arrangements, limitations related to health care, along with other issues, created conditions of disenfranchisement and harm. The research was funded by the Social Science and Humanities Research Council of Canada and York University Faculty of Health. Renata Burnette, reporting for the HGP Nightly News.